as Sami said, that I've got two hats, an academic hat, and I've got an NHS hat working in diagnostics and clinical biochemistry in particular. And so I'm very familiar with what Frank described a lot of the issues. And so without a doubt, when I hear all this, everything, all the fantastic ideas and potential innovations that potentially you bring into diagnostics, as an academic, I always feel very excited. But then, of course, on the other hand, as a diagnostician, I know that it's not always easy and to achieve that, especially in the context of the UK diagnostics in the NHS. So, and I think in many ways this message, this discrepancy, if you like, it's just basically is reflected in our landscape report that we've been awarded with us to put it together. And I'm presenting some of the key themes. And together with Emma Braybrooke, who is one of our senior biomedical scientists at UHCW, and Neil Addison, who was the clinical director of pathology, we're putting together. So clearly, it's not just about the future. Not to understand the future, not to understand to paint the big picture, understand what's the current landscape of diagnostics. And the way that we approach it, we were looking in describing, putting together the current landscape in diagnostics, especially some of the key players, the infrastructure, and the regulatory environment, which, as you've heard already, was mentioned, that's one of the key points in order to translate innovation, to bring innovation into the routine practice. And of course, then you can have the trends and developments, the challenges, the opportunities. All of this you already, Vicky, Frank, they start mentioning and describing some of these. So I can briefly mention, but for the interest of time, I'm not going to spend too much time because a lot of what said already is very relevant to our report as well. So also, just remembering, although our report is about focusing primarily on blood testing, and in particular, the areas of pathology, the specialist pathology, which are relevant to blood, which is hematology, immunology, molecular pathology, and clinical biochemistry or chemical pathology, but also a lot of it is also relevant to other specialties such as histology and microbiology and virology, that there are different branches, different specialties within pathology. And also, it's worth remembering that although we try to use it differently, although diagnostics covers both imaging and pathology, so sometimes we tend to use pathology laboratory medicine to differentiate between from the diagnostics, which are more focused on imaging. So the key players in the UK, and this is important because the UK is quite unique in its own setting. Most of the diagnostics, the vast majority of diagnostics is provided by the NHS. So the NHS, it does over 99.9% of all diagnostic procedures that are happening in the country. Of course, there are private diagnostic providers. Some of them, they're working through contracts for the NHS, but or they work independently. As you heard from Frank, Frank is a good example of an independent potential provider offering specialized testing. But at the moment, this remains a very niche, very focused area. And of course, then you have academic institutions, pharmaceutical companies, the diagnostic, biotech, all work in the environment that they will fit into essentially into the NHS. Now, here is some data, some evidence about the scale of the UK diagnostics. In terms, the diagnostics is organized around about 105 hospitals. We deliver about 1.2 billion tests a year. Okay, there's an employment of about 30,000 now. The workforce of clinical scientists, biomedical scientists, laboratory assistants, and all the workforce in the NHS diagnostics. And NHS diagnostics, it is said, without a lot of evidence, I have to say, that about 95% of the clinical pathways, they involve diagnostics, and about 70% to 80% of all diagnostics involve some interaction, input from the lab. There are about 500 million biochemistry tests and about 130 million hematology tests that they're carried every year. And for each person, and this is important to remember, on average, there are 14 tests per person that are happening annually. 300,000 tests every year. So all these statistics identify the massive, the scale of the operation, and this is within the context of the NHS. The NHS spends over 6 billion in diagnostics and about more than 2 billion in laboratory medicine. So there is a lot of investment going into this and to carry out about the 1.5 diagnostic tests. And however, here comes the issue with the experience of the past few years. So generally, diagnostics is under-recognized, and there was underfunded, and there was inadequate resources to keep the service, to keep the operation going. And for every £100 that you spend on the NHS, only about £1 to £2, about 1%, 2% is spent on diagnostic testing. So there's always, and this has been mentioned before, for the past 20 years, there was always a drive to achieve more for less. So, and this became the dominant driver, the dominant thinking around this, around the diagnostics in the UK and globally. So some of the issues that we're discussing, it wasn't just UK specific, it's also relevant to other countries as well. The diagnostics group itself, they try to identify the value proposition, they try to identify what is there to offer. And of course, there was always the question or the dilemma, do we reduce the cost or we increase the value of the laboratory services? Where should we focus? And that's always been the question asked intrinsically from within the profession. And of course, we all know that actually the diagnostics, they deliver, they play a very important role in the care of patients. And so, but how you define the value of this? And the idea is that what you need to present is actually the role of diagnostics in delivering the right test result to the right place, to the right patient, and having the right impact. And that is the value, the value proposition for the laboratory services. In trying to identify, of course, the value proposition, the group, they brought a very interesting toolkit that potentially can be used across all the different aspiring innovators that want to bring new tests into the NHS, into the clinical care, because all these are very important parameters that everyone should be able to feel and address. For example, what is the clinical need? What is the patient population? What are the properties of the test? And all these are required in order to be able to bring the test into whatever regulatory bodies you have in order to adopt it by the NHS. And of course, talking about regulation, I'm going to spend just a couple of slides very, very quickly, because all the UK diagnostics, they have a very strict regulatory environment in order to ensure safety, effectiveness, and quality of the various diagnostic tools. So there are there are regulatory bodies that are looking after the MHRA, for example, about the products, about the registration of the people involved in diagnostics, so to be able to deliver the diagnostic services, and of course, everything that you heard before, all the key CE marking, the IVDR, the laboratory accreditation, which is very important, and this is something that applies even if you have an NHS lab or if you have an independent lab, you still have to go through UCAS accreditation, and of course, the data protection and privacy laws, the GDPR, which is also becoming very important. So, asking various professionals about the regulatory challenges, considerations, and opportunities, they came with some of the common themes around how we can make the regulation work, make it more approachable and more fit for purpose for the innovation that is happening. For example, one of the issues that has been identified, especially from the industry that they're operating across different countries and globally is that since post-Brexit, the UK developed their own regulatory standards, and there needs to be some harmonization between the UK, the European, and the global, because a lot of these companies, a lot of these innovators and industries, they want to operate globally. So for them, it's very important to have across the same standard applied. And of course, the collaboration, the agility and flexibility, and this is how the regulation, for example, can be used in order to work together with the industry to harmonize practices. And of course, the research and development. You heard Frank talking about Innovate UK. How much funding there is available to ensure that the companies, the innovators, the biotech companies can work and develop and make them fit for purpose for operating in the UK market. So, and this was one of the key questions asked: is it fit for purpose? So the response that we got is that possibly it could be a lot better, but not at the moment. So there is a number of areas for improvement. They all come, you can put them under these key themes. And of course, there are a very long list of recommendations how you can improve the regulation. Now, this part of my talk, and I'm not going to keep it very long, but this is very important because identifies some of the current mindset of the UK diagnostics in the NHS. For the past 20 years, the modernization agenda, the service reconfiguration has been the driving force in everything that happened in the UK diagnostics, I said since the turn of the century. And the important one, the concept of managing pathology networks, and that was basically the driving force, was first introduced in 2002, more than 20 years ago. And the aim, you be careful, was to reduce cost, meet increasing demand, achieve efficiency savings, while modernizing the laboratory infrastructure with new technologies. Somehow, most of the driver, they stay in the first 5 words. How to reduce cost and meet increasing demand and achieve efficiency. They never went beyond that in order to see how potentially we can modernize infrastructure, because this is the last part, is how you can make the system ready to bring new innovations that we'll be discussing, and you're going to hear more about it. And of course, there was a number of reports issued, all addressing the same thing, which was how we can minimize unwarranted variation. So, for example, we know that the NHS, there was different diagnostic services and in place. There was quite considerable variation across the different labs. So how we can improve that? But of course, the solution was to come up with a hub-and-spoke model and the delivery of a number of networks. Of course, one of the key drivers to achieve this is to achieve efficiencies and cost savings. And there were, for example, there was mentioned there would be about 200 million savings potentially. Now, we know that, I will just move into this, is that there are a couple of studies, not a lot, but there are studies where they assessed whether these savings were achieved. And of course, the outcome of the studies, of the scientific papers, yes, that there is definitely the managed networks achieve, the consolidated networks, they achieve cost savings, of course, but however, more research is needed to demonstrate what is the source, what's the cause of this. There are a number of key players within the UK diagnostics, such as the College of Pathologists, the Association of Clinical Biochemistry, the IBMS, and of course, there is a driver to reduce unwarranted variation. There is the drive to ensure optimal provision of services and to provide the value, and especially to provide the quality to remain at the high levels. So the priorities during this, for the past 20 years, as it was set up, was to develop a national specification for improving quality, the creation of standalone pathology services providers, end-to-end IT connectivity, including point of care wherever possible. So you can imagine in an ideal scenario, when you bring this type of innovations that Frank described, how potentially you use it as a point of care, and you can have the data generated through those devices, how they can fit directly into the lab, into the laboratory system, and they will automatically find their way into the electronic health record of the patient. And how you can integrate the service improvement in large-scale workforce change. And the last one, I mean, the workforce is something that's very important. Because remember, there is quite significant workforce that delivering diagnostics, and they are in desperate need of improving skills and get them right up to be able to work and adopt the new technologies. And of course, this can be achieved through a stronger clinical leadership. Now, of course, this will happen during the over 20 years, and then, of course, the COVID pandemic happened. And of course, at that point, during the COVID pandemic, the UK diagnostics, this was how most people would see it. First of all, the staff shortage, there was considerable staff shortage and limited skills to be able to adopt to the pandemic. It was underfunded. There was limited uptake of innovation, and that, of course, had an influence on the mindset, because a lot of the people were very skeptical to adopt or to work with innovation. And of course, the focus was on cost savings. And there was, again, coming back to what we say, there was excessive and fragmented regulation that prevented the easy flow of innovation in new technologies. So, and of course, that was the point where there was a lot more interest about diagnostics in the, not just in the UK, but globally. And there were a number of reports that they came out where they were asking the question, where do we want to have diagnostics over the next 20 years? Where we have achieved what we achieved so far, and I think that in the UK, diagnostics fare pretty well, and globally, despite some hiccups at the start. Eventually, they were able to put something together, and they were able to address some of the needs of the pandemic. And there was a lot of reports how we can, what's next, what's coming in the next 5, next 10 years. And every single report that was produced by think tanks, by the Department of Health, by NHS, they agree there's an urgent need to reform the diagnostic landscape. And we know that we're addressing health priorities, we're addressing an aging population with chronic conditions and mental health issues, and chronic conditions of an aging population means a lot of multimorbidities in the community that they need to be addressed. There is a crucial need to deliver the personalized medicine ambition, bringing examples, as you heard from just now, and I'm sure you're going to hear a lot more over the next day and a half. And of course, it's important to deliver the long-term NHS plan, which is, of course, this is what the NHS diagnostic is about. And of course, if you read the pages within the NHS long-term plan, looking ahead, there is a commitment to address some of conditions such as heart disease, such as cancer, respiratory disease, stroke, and MSK disease. To do that, you need to have a very strong diagnostics in place to be able to deliver it. Without it, it would be impossible to achieve any of these commitments. And yeah, so there's recognition that there needs to apply innovative ways. You need to think differently in a way. And the way forward would be, for example, the message to enable patients to take control of the chronic conditions. It is very much what you just heard. It's just talking about fertility, but the same could be about obesity, about diabetes, of all kind of chronic conditions. And of course, on the diagnostic side is the fact that now the public is a lot more aware, a lot more interested about diagnostics. And when we asked the question, there was a number of key messages that they came about the awareness of and the interest of the public. The rapid testing development, various government initiatives, and also remote diagnostics, innovation, long-term health awareness, trust and reliability, and of course, the people now are more educated. And increasingly, but remember the difference, the impact of education, for example, and information in the different parts of the UK, which are very different. So in West Midlands, for example, one of the major problems that we have, and we always look what we do to address the needs of the local population, we are top in the country, one of the worst in Europe in diabetes outcomes, in diabetes comorbidities. So for us, in the Midlands, this is the priority. This is our target population that we had to improve the health around these areas. Much of the messages that came from Frank's talk was about struggling to have access to healthcare. At the moment, and this is driven because of the massive backlogs post-COVID, but also generally because the system is not delivering the promise of care for the patients. And this is when we start seeing an increase in private providers. The issue with this, and this is what needs to be a lot more coordinated approach, is that a lot of the interaction between the patient and the private provider ends up going back into the NHS. So if you send examples for cholesterol testing, for example, someone comes back and says, oh, it is slightly raised, it will go back to the GP. So there will be pressure going back into the GP, into the healthcare system, in order to discuss some of the results of the private tests. So, drivers of change clearly is the emerging clinical needs, the role of diagnostics, which of course, service configuration, generating guidance and evidence, and to evaluate the technologies. A lot of this, you ask the question, how the innovations will find their way into the NHS. The labs, the diagnostic labs in the UK will be asked to evaluate these technologies and demonstrate that actually they are fit for purpose. And of course, the most important, which I think is the refinement of clinical pathways. Clinical pathways, especially as they were designed and recommended by NICE, they change. Now more than ever, they change very, very quickly because they bring new innovations. So again, diagnostics will play a key role into delivering this. And so of course, some of the challenges and opportunities is that where all these, the meat would be around diagnostics, is about multimorbidities, aging population, clinical pathways, the point of care, near patient testing and point of care, community diagnostics, which is the next drive, is just moving diagnostics outside of the hospital into specialist community centers, reducing health inequalities. That's another promise, another commitment of the NHS, the 20+5 initiative to reduce the health inequalities in the 20% of the population. And of course, the COVID backlog and the service configuration. And of course, on the other hand, you have the concepts of precision medicine, personalized medicine. So on one hand, how are we going to deal with all these, which are problems now, right now, while there will be sufficient space and room to bring some of the new concepts? Because the precision medicine, it will all be AI-based and development of novel biomarkers. And of course, the public expectation, which is very important, is becoming increasingly more important. Because increasingly now, there is a push where the public will have direct access to their health records, the results, and of course, they will feed back some of it has an interaction with the diagnostics. So you've heard that already, some of the key enablers, how to deliver that. So I'm not going to spend any more time. So, however, as far as diagnostics go, there are some key opportunities. And this is around leadership and collaboration, how the laboratorians, the diagnosticians, they will move out of the lab into the influencing the whole of care, the healthcare. Nurturing innovation, again, is very important. And this is directly relevant to what we said, is that for more than 20 years, the diagnostics group, they were, the main focus was how to do more with less. So they need to change that. They need to start thinking how they're going to invest all the savings into bringing innovation and maximizing resources. Just give an example. In 2019, in England, there are 300,000 molecular microbiology tests in total. this, at the end of the pandemic, that was what was done in a day. So you see how it changed the infrastructure, the capacity to do more during COVID, how we achieved it, how going to make good use of it. And of course, engaging the public, which of course is very important. And this is how you can achieve more. And you can have the, similar to the crowdfunding, it's how you get the public to put pressure in order to put the diagnostics in the center of the agenda. So I think I'm going to skip this because I think that we mentioned a lot of this. So this is, I took this slide from the Lancet Commission on Diagnostics, which basically identifies some areas where AI potentially could be very important. And this is not just into predictive analytics, how you improve outcomes, but it's also how you manage how you make more, you generate more efficiencies, and how you manage the operation within the lab, which, as you've seen in the first few slides, is quite massive, especially through the hub-and-spoke model. And one last slide is about the workforce. And this is, the workforce is very important. This is the key component. And at the moment, there are gaps. We need to get more into the labs, into the diagnostics. And the expectation is that we will need to increase the workforce by 13% over the next 5 years, and probably by 32% in the next 10 years. So how are we going to make sure that we retain and we train the new diagnosticians? And of course, the key issue is how you bring the right skills to these people in order to meet all the demands of the new healthcare. And so we talked about the 5 priorities, which are mentioned in a report by McKinsey and company. So I think, again, it reinforces the same message. So the conclusion, and I'm going to stop here, is that of course, diagnostics, especially blood diagnostics, are crucial components of the healthcare system in the UK, but globally as well, even in the low to medium income countries. And of course, there is a clear path. We need to embrace the digital technologies, and we need to bring research. We need to collaborate more between industry, academia, and the NHS, and work together and start integrating some of the innovations around digital pathology and AI. And this is bringing the policymakers and the healthcare providers into this, because one of the messages right at the start during the modernization was that the funder could not really appreciate and understand what's the role of diagnostics into the healthcare. Okay, so that was an important point, and this needs to change in order to shift towards the modern diagnostics. And on a plus note, I'm going to leave you with what I found on the internet. What's a better time to build the UK diagnostic sector fit for purpose? So thank you very much for listening, and apologies.